Maybe some rain coming in between 10 and noon. Otherwise, back to our regular summertime routine for the weekend, which means hot and humid and a chance for showers. But what are you going to do? It's June. It's also Men's Health Month. Dr. B joins us from People's Health to talk about 3 health conditions that commonly affect men. Good morning, Dr. B. How are you?
Hey, Tommy, I'm doing great. How about you?
I'm doing well because I got my blood pressure under control. I don't have diabetes, and I've been screened for prostate cancer, which is what we're going to talk about. Those steps to stay healthy. Let's start, I guess, Doc, by talking about high blood pressure. What is it?
Yeah, sure. So blood pressure is actually just the force of blood against the walls of your arteries. So when the heart pumps, it creates that top number of your blood pressure, and when it relaxes, that's the bottom number. And the arteries that it's pumping blood into really just carry blood from your heart to all different parts of your body. So what happens when you have high blood pressure is you're exerting more force on those arteries when your heart is beating, and at a high enough force, you can actually cause damage to those blood vessels. And that can lead to a lot of serious heart problems, but primarily we see heart disease and even stroke happen.
How common is high blood pressure?
Extremely. It is really one of the most common chronic conditions. Nearly half of all Americans will develop high blood pressure at some point in their life, and a lot of people don't even know that they have it. That's what's a little scary about high blood pressure, because we sometimes call it the silent killer because it may have no symptoms at all.
What are the symptoms of high blood pressure?
Yeah, so like I was mentioning, it usually doesn't have any symptoms at the beginning. Really, really high blood pressures can cause some symptoms for people. Really, the best thing to do is routinely get your blood pressure checked, and you're going to get that at your doctor's office. They're going to check your blood pressure every time you come in. They're going to ask you how to check your pressures on your own, too. If you've had elevated blood pressures, you can do that with just an at-home blood pressure cuff or sometimes at a local pharmacy. If you do have symptoms from high blood pressure, most often one of the things we'll see is headache, maybe blurry vision, or even a little bit of chest pain.
What's considered a normal blood pressure level?
Yeah, so I mentioned that, one number over the other, so it's always going to be reported as 2 numbers. So a normal reading would be 120 over 80, and really anything less than that is in the normal range. But the important thing to keep in mind...
8:15 now. Doc, you broke up a little bit. The important thing to keep in mind is?
Yeah, the important thing to keep in mind is that it's going to be individualized to you. So sometimes your blood pressure target may be a little lower or a little higher. You want to talk to your doc about it. And healthy habits like exercising and eating well are really the best place to start.
Yeah, I've recently lost a lot of weight, and I've exercised. I exercise a lot, and the doctor actually I took my blood pressure. It was low. He had to take me off of the medicine. That's kind of uncommon, I guess.
Well, actually, if you do lose weight or you make those healthy lifestyle changes, you may be able to get off the medicine or at least reduce the medicine. So that's fantastic.
You do have to watch it, though, and that's not, nobody should do anything unless they talk to their doctor first. Let's talk about diabetes. What is that?
Yeah, so diabetes affects how the body turns food into energy. And so when you eat, basically your body breaks down food into sugar, and that sugar goes into your bloodstream. And normally that signals your pancreas to release insulin. I want everybody to think of insulin as a key. It actually unlocks the cells and actually allows the sugar to go into the cells to be useful. But with diabetes, what happens is either the pancreas can't make insulin, or maybe it doesn't make enough insulin, or the body can't use that insulin properly. So that means that the sugar can't get into the cells and it builds up in the bloodstream. And then over time, that elevated blood sugar can cause a lot of damage to your organs, especially your heart, your kidneys, your eyes in particular.
For the first time, I understand now how insulin works with that key thing. That's a great way to look at it. How common is diabetes?
Yeah, so unfortunately, diabetes is pretty common as well, especially here in Louisiana and really across the entire South. And it's about 500,000 adults in Louisiana have diabetes, and thousands more are diagnosed each year. And the most common type you see really across the country is type 2 diabetes. It accounts for about 90% of the disease we see, and that is usually caused by an insulin resistance or not enough insulin in the body. It usually develops in adults, and it's usually after age 45.
So type 1, I don't want to be negative here or pejorative, but type 2 is a result maybe of your behavior or what you eat, or not necessarily?
Yeah, a little bit more so. So things like weight and inactivity definitely play a role in type 2, whereas they usually do not in type 1.
All right, some of the symptoms of type 2 diabetes?
Yeah, so if you do have symptoms, and some people may not really recognize them, you may get a little bit of blurry vision. A lot of people will complain of just kind of generalized fatigue or weakness. And interestingly, people may lose weight right before they're diagnosed with diabetes. And they typically will have an increased hunger and thirst because their body's losing too much water and trying to burn those calories inappropriately. And then one thing we see in particular is difficulty healing. So you get a little cut or a sore on your arm or leg, and it takes a really time to heal up. And like I said, the symptoms are typically mild, so people may not notice them. They could live with that condition for a really long time. So that's why you should always have your doctor check your blood sugar.
We're going to take a break, come back, talk about prostate cancer. But before we do, doctor, when it comes to prediabetes, does that mean you are overweight or are living a lifestyle or have some stuff going on that it means you're in a prime position to contract diabetes?
Yeah, it definitely can. And kind of the key with prediabetes is it's a warning. You know, we always say prediabetes can be cured through lifestyle changes, but once you've got diabetes, you've got it for life.
And for example, being overweight, I guess, or eating too much sugar, those are the kind of things that make you pre-diabetic? How do they determine that?
Yeah, it's not so much the eating of the sugar. A lot of people think that. It's really being overweight and inactive in particular. Inactivity makes your body have more difficult using the insulin that it has. So that inactivity and then being overweight is your two biggest risk factors.
So they do determine prediabetes with a blood test, or do they determine that just by analyzing your lifestyle and where you are with weight and exercise and so forth?
No, it's a very simple blood test that often can actually be done and resulted right in the clinic. Wow. So it's something your doctor can tell you right away.
All right, very good. Thank you. We'll take a break, talk about prostate cancer when we come back. 8:20 Traffic Now, WWL. It is 8:25. Tommy Tucker, WWL, talking to our friend Dr. Brent Wallis, Chief Medical Officer of People's Health. It is June is Men's Health Month. We're talking about high blood pressure, diabetes, and prostate cancer, three conditions that commonly affect men. We've covered the first two. Now we move on to prostate cancer. What is that, Doc?
The prostate is just a small kind of walnut-shaped gland that's part of the reproductive system in all men. And so all men are going to be at risk for developing prostate cancer with that.
Doc, you're breaking in and up. I don't know what you're doing with the phone, but I would prescribe that you move back to where you were, and maybe we can get a good signal. You there?
Oh, I'm sorry, Tommy.
Right.
I didn't even move. Is that any better?
That's better. Yes, sir.
Okay. So what I was saying is prostate cancer actually happens when abnormal cells develop in the gland, and they start to divide uncontrollably, and it can affect tissue all around that prostate area and even spread to other parts of the body.
Is it pretty common or not?
Yeah, it's unfortunately extremely common. In fact, it's the second most common type of cancer in American men, and about 1 in 8 men will be diagnosed with prostate cancer at some point in their lifetime.
Wow. That's pretty significant. What are the symptoms of prostate cancer?
So typically at the beginning, and depending on where the cancer develops in your prostate, it may not have any symptoms at all in the early stages. If it becomes advanced and the tumor grows, you usually will see a weak urine stream when you try to go to the bathroom. A lot of men will have real frequent urination, especially at nighttime, getting up multiple times during the night. They may even see some blood in their urine, or even have a painful or a burning sensation when they go to the bathroom. And then really advanced disease, they can actually start having some incontinence or some loss of bladder control. So if you have any of those symptoms, you want to talk to your doctor right away.
So what about screening when it comes to prostate cancer?
So, here's where there's a little bit of controversy because some of the national agencies disagree somewhat. We usually use the U.S. Preventative Services Task Force recommendation, which in 2018, they changed that recommendation to no longer recommend general screening of asymptomatic men for prostate cancer. And it's kind of interesting. One of the reasons for that is we were identifying a lot of prostate cancers that perhaps were not as consequential. And so we see a lot more men die with prostate cancer rather than from the prostate cancer itself. They die from something else. So what I always tell people, it's a very individualized decision between you and your doctor to be screened. And if you do have family history in particular or other risk factors, you definitely do want to talk to them about getting screened.
Is there an age, a beginning age where men really need to worry about this?
Yeah, typically the 50s and beyond, but I'll tell you in some groups, in particular African-American men, or especially men who have a first-degree relative, so a brother or a father with prostate cancer, that you may need to get screened a little bit earlier. So that's why it's so important to make sure you're having that conversation with your doctor, and you don't always want to talk about some of these symptoms, but it's important that you do.
I don't think men necessarily love going to the doctor. I don't know that anybody does. No offense, Doc, but how can men make their health a priority?
Yeah, men are extremely less likely than women to have regular doctor visits. Just ask my wife. And, but it is an extremely essential part of staying healthy. And so you want to work with your doctor to create kind of these personalized screening schedules and preventative care plans, because this is how we identify disease and set you on the right path so that you're not developing and having problems with things like blood pressure issues and blood sugar issues as well.
Some other ways to commit to healthy living?
Yeah, I mean, it's like we always say, exercising is critical. Inactivity is bad for all chronic diseases. So make sure that you're trying to get exercise 30 minutes, 5 days a week. Eating nutritious foods and really avoiding a lot of those junk foods can help as well. And I can't say it enough, if you smoke, you've got to stop smoking. Smoking leads to a lot of these diseases as well.
Thank you, Doctor. Very valuable information. Have a good weekend. Hit the pool. Stay cool, all right?
Thanks, Tommy. You too.
You bet. You can find out more about People's Health by visiting the People's Health Medicare Center right there in Metairie, 3017 Vets. Next to Party City, appointments are recommended, but they'll gladly take care of you. If you are a walk-in, you're welcome. You can also visit the website, peopleshealth.com, or always call People's Health at 1-800-978-9765. When we come back, we're going to talk about a special session dealing with car insurance, which is out of control right now. Time for WWL First News.